Hey, everybody. Welcome to the Chicks with the Wisdom here. The four of us are good friends. And we also, if you put all of our years in wheelchairs together, we're probably 1,000 years old.
That's right.
Um,
At
so
least.
from the top, we have on my computer, we have Ellen Stohl. There you go. Mickie Fowler, Michele Altamirano,
Guys.
and me, I'm Julienne Dallara. And the girls are allowing me to start out with a story because this has just happened to me and it's absolutely turned my world upside down. So I went to a new doctor about 5 days ago and they ran my insurance card and said, "Oh, your Medicare has been terminated." And I went, "No, no, 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 no." Like when they say your credit card doesn't work, just run it
Yeah.
again. No, and they said, "Call Medicare." I said, "I'll be on hold for an hour, but okay, I'll
Yeah.
call Medicare." Finally got a hold of Medicare. They said, "I've never seen anything like this before. Apparently, your Medicare was terminated 3 years ago. We sent you a letter." And I said, "Wait a minute, hold on.
Yeah.
One letter by mail in the middle of COVID, and then you just terminated no more information than that." Okay. But Medicare continued to pay all of my doctor bill for 3 years, continued to take my monthly payments for 3 years. And then just because I went to a new doctor and they ran it, all of a sudden, nope, you're terminated.
Wow.
So then I talked to two different people at Medicare. Then they said, call Social Security. I called two different people at Social Security. And the upshot of it all was they said, "You have worked too many years, not made too much money. Didn't matter how much money I made. You've worked too many years since Medicare started. You're allowed to work, I think, 7 3/4 years after you started your Medicare. And after
Wow.
that, they determine that you are no longer, due to a cessation of your disability, you will no longer qualify.
Are
So
you?
if
I,
you
oh.
Yeah,
if
you're
you
you're
work
no
more than
longer disabled
Yeah.
because you can work
But
if
are
you
again.
work
you
more
are
than
you on the 250% working disabled program?
I have no idea what you're talking about, so why don't you take it and tell
Just
us what
because
you're
I
talking
have
about.
worked well over 7 years and I still have all of my benefits, but I am on the 250% working disabled program. And so that
Okay.
actually allows you to keep your Medicare and Medicaid even if you lose your cash benefits. And so, even if you're working so much that you lose your cash benefits, because like in home supportive services, I can't go to work without I mean,
Yeah.
I can't go to work without support. I just can't. I can't.
Yeah.
So I can't lose that even if I make money. I need to be able to get that. And of course, healthcare, any company plan is like, oh, pre-existing condition. We don't cover crap. Um,
Yeah.
so,
Exactly.
so yeah, it's called the 250% working disabled program. And you have to sign up for that. It's on the Social Security site, but yeah, it's crazy. I mean, the system is great until it isn't. And then when it goes to shit, then it is a shit storm getting it back and getting it to work. Um, and that luckily, because I have been going through hell since December of 2022. So what is it now? A year and a half of not having my cash benefits, just making sure I get my other benefits and stuff. But it's all letter writing. And again, you call. This year, I just want to tell you, Juliana, they sent me my new Medicare card, and it was Allen, Allen Stohl. Right, same
Oh,
number, same everything, but Allen Stohl. And now, when my providers are submitting, they're getting their bills sent back because it's the wrong name.
Oh
so
And
my
I'm
how's that
like,
God.
exchange go for you anyway?
yeah.
Oh,
So I
Well,
had to, call Social Security like you did an hour. They said you have to go to the office and get it changed. And then some people were smart enough just to bill under Allen Stohl, like they got it back and they're like, oh, we'll just change the
yeah.
name and bill it, right? It's the same number. Other people weren't. But then I come back and get my name changed back to the right name. and
Oh
and
God.
and then they're coming back with the Allen Stohl coming back. And they're like, wait, it's
may-
not working. I'm like, that's
maybe
because
they,
it's Allen. I
maybe
know
they,
they're right close to each other.
maybe they thought
ENA.
maybe they thought you were becoming a trans.
Maybe, but even then, it was the same number, same last name. So, maybe I can change my name to Alan. I don't
Alan.
mind being, broadly accepted and being open to men and women. Hey, what the hell, right? But it is crazy. So, Juliana, look at the 250%. But go ahead and go on. That popped into my head as to how this happened to you and why it hasn't happened to me.
Well, a friend hooked me up with a Medicare professional, and I have a phone call with her at 4:30 today because my question is, how do you object to all this? Isn't there an emergency process to, what's the word I want that starts with an A? Object to it?
Oh,
Appeal. You want to
Appeal.
appeal.
Oh, that's right.
And you want an expedited reinstatement. Because they
Yep,
can
that's
do
what I
that
asked for,
immediately.
but I also, through Covered California, thank you, Barack Obama, through Covered California, I was able to get private insurance despite all the pre-existing conditions,
Awesome.
but it doesn't kick in until July 1st.
Oh,
So going for no insurance for a month, and the trick is I also get IVIG. I get an infusion of IVIG every 3 weeks. If I don't, I stop breathing.
right. Well, that's not good.
So, no, and it's like a $10,000 infusion.
Maybe they'll
So,
backbill or, you know,
is that legal?
I will just say that I have worked with, my dental insurance and other people that have, back billed or billed at an earlier date to make sure it was in the coverage thing. So, yeah, I think you have the insurance, they have the money, it's coming. I think that they want to get paid and they know you can't pay them. They don't want you to die. So I think it's just, massaging the system is what I like to call it. Sometimes we have to work in
Nice.
the gray areas. So, I mean, I think that's part of having a disability, and, experiencing the medical issues we all experience. We have to sometimes massage the system. And I think that, really astute and good providers understand that. And so they're willing to work with you within their parameters without, actually doing something completely illegal.
Yeah. Right. Well, got to
Yep.
get creative.
Well, I am going to put my phone number in the chat in case there's anybody listening, watching, who has been through something like this and wants to share their story with us. So if you have, give me a call, I'll put you on speakerphone, and you can tell the world your story and any suggestions that you might have.
I mean, Mickie or Michele, have you ever had issues? I mean, mine is always about when we work with people. If I get the right people in the system, they work with you and they realize your situation. But if you get somebody who's just black and white and cut and dry, it can be incredibly difficult. But I mean, 41 years in the chair, and I've found some amazing providers that know how to write stuff up to get you exactly what you need. And Juliana, if you need any, I don't know what catheters you use, but I have enough for the apocalypse stored away. So
Thank you. So
Okay.
do I, luckily, because one of my clients at the Abilities Expo is Cure Medical. So they sent me extras a long time ago. So that'll get me over the hump anyway. But it's scary finding new insurance and not knowing, are they going to cover the stuff I need? Or am I going to pay, $1,500 a month and not be able to go see my doctor, go get catheters, whatever I need?
Yeah. That's great. It's scary. It is scary out there. If anybody wants to chat instead of call any issues they've had. But Mickie, have you experienced any insurance issues or
Not
medical issues?
recently. Just my medical supply. I have to keep reminding them on a scheduled shipment every other week for catheters. And of course, they never seem to arrive on time. So now I can text them and remind them.
And then you're short. Wow.
You guys have too many, and I don't have enough.
Are you in? Are you? You're not intermittent though, are you?
No, I've been using a suprapubic.
Okay, that might be harder with that because
It could be.
Oh, my people are like, yeah.
Otherwise, it's been okay.
That's good. Michelle, sorry.
No, I think the biggest challenge is that you're talking to different people every time and you're having to retell your whole story all over again. You think the person you talked to is taking notes and putting them in your on your records, but no.
Nope,
So you
they're
have to
not.
start over, and then sometimes one person is very knowledgeable and then somebody isn't, so they tell you one thing, and then another person tells you another thing. And then you say, okay, can I go into the office? No, the office can't help you. Well, what is the office there for, you know? So it's just,
Yeah.
yeah, that thing.
I
And
have every letter I have ever received from Social Security
wow.
for 41 years. I have
Wow.
never thrown away a letter because there have been times I had to go back and say, "Oh, no, 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 no. You wrote this at this time. At this
Wow.
time, you said my disability was still continuing. Why is it not now?" So, um, simply because it's like you have to become a lawyer almost,
Mhm.
Yep.
and keep track of everything and every conversation. And literally, when I was going through the stuff I've been going through last year, I wrote the White House. And of course, I did get a letter back from President Biden. I'm sure it's not from President Biden, but I did get a letter from the White House, and they're like, and they did contact the Social Security regional office in San Francisco, who contacted my local office, but that pissed the lady off, and she was like, if you
Mm.
keep going to people, it's going to cause problems with your case. And guess what?
Wow.
There were problems with my case. So,
Oh,
yeah. So, but I'm going to a
Wow.
hearing this July, and I actually have all that written down and the dates and what exactly she said and who I spoke to and the letter from President Biden.
Always have
And
to ask.
Yeah.
Always ask who you're talking to, and like you said, document everything. But the fact you have all those letters is great. You probably have a
The
really
number,
thick
yeah.
file.
they're
well,
somewhere, but
I did write to my congresswoman and got a response back right away. Um, so after I talked to this lady today at 4:30, I thought I'm going to email her back, and actually the letter came from the same guy I had talked to when we did the United Spinal visit all your Congress people thing. So it's her assistant, Anthony, and maybe they can do something. I have no idea. I called lawyers and I called the newspapers.
good.
So, yep. I
Yep,
mean,
that's the only way to make a change is to advocate. You cannot sue the government
Yeah. Yeah.
for these policies. We just have to
but
advocate and get our Congress people to change things.
you can be loud. And I'm telling you, after this, something's got to change in Medicare so that you can safely work and not lose your benefits.
Yeah.
Now, I
Maybe
never
that's
had, since I started working, I never had cash benefits, and I don't want them. Those should go
Yeah.
to people who need it. I don't need it because I'm working.
Okay. Yeah.
Um, but just counting the number of years and then cutting you off, that is,
Yeah.
Yeah.
it's insulting to assume that, oh, if you work, you must not be disabled.
exactly.
Hi, Andrew. Thanks for watching.
Hey,
Any comments you
Julianne,
want to add?
maybe that's one reason you were crowned Miss Wheelchair
Oh, I've got to
USA,
type it up.
because you'll be advocating more than you would normally for things like
Yeah.
Well, the
this.
platform was to get nonprofits to work together. I am so angry, I may just change my platform to let's change Medicare.
You
Yeah.
Oh,
can
wow.
have two.
There you go.
You can have more than one.
Allow disabled people to work.
There you
Yes.
go.
Yeah.
That is a huge, a huge issue. I really, if you look at the history, I think I said this in the last show, the ugly laws, which were there to keep people who were so displeasing to the eye off the
Huh.
streets. They could be
That
fined
is,
and
yeah.
they could be fined and imprisoned. And these were on the
Yeah.
law books until 1976. So
They were really called that.
they weren't called, they're
Yeah.
basically, yeah, I mean, that's the name that they came up with because if they didn't like your looks, I mean, we can get you off the streets. And I feel like the system, although there to support, is also designed to sort of trap people on it. You can't work
Yeah.
too much else you do this. You can't do that or this. So,
Yeah.
it's enough to keep you going, but not letting you get out there and live fully and work fully and, get
Yeah.
those supports that you need, which is in
Exactly.
essence keeping you out of the streets, out of the area where you could, create more change, more structural systemic change. So it does have to change. And Juliana, you would be a great voice to start, shifting these changes and, become
Because it
the
keeps
advisor to the
people in
president, like
fear, right?
Rebecca Coakley. She was Obama's advisor on disability policy. So why not
Well,
Julianne?
I wouldn't be able to have insurance. And
Yeah.
and I got to write to him because I have so much respect for that and that change. But as I'm talking to people, I realize how much fear people are in, fear of losing their
Losing
benefits.
it.
Yes.
And if you are one of those people who like power, what do you want to do? You want to keep people in fear because then you can control them.
Yeah.
Mhm.
So Andrew in the chat is saying he was a DHL delivery driver. He's had his crash 3 years ago. Andrew, if you just pop in, like, how are you looking at work and are you getting your benefits? Just let us know if that's working for you.
Yes, or you can phone.
Or you can
That's
phone
fine too.
Juliana's up there.
My number's in the chat.
Yeah. So what
Do
about
you,
health issues? Like, have you had, ladies, because I have been dealing with, menopause. It's one of the things, Andrew, you probably don't have to worry about menopause as your name indicates, possibly, but your partner might, and it shifts things and it changes things. That has been a difficult transition for me.
Yeah.
Also because I don't sweat, so I don't get the night sweats from it. Like, I only sweat when I have dysreflexia, which is dangerous. But I don't sweat that. But I do get overheated. Um, Andrew had cancer treatments too, so he's been off work. But I also have shingles, which I've had the vaccination. I have shingles, and I didn't notice for the longest time because, well, we don't have normal pain sensation. Those of us with spinal injuries might not.
Yeah.
And I would just get really horrible, horrible backaches, and then I would get this rash, and I'd be like, huh, what am I'm sitting wrong? What am I rubbing?
Yeah.
And then
Rubbing
finally
somewhere. Yeah.
my friend looked at it and goes, that's shingles. I'm like, what? What the hell is shingles? And she's like,
Yeah.
well, if you had the chicken pox, so this is the crazy thing. You have chicken pox as a kid, that virus is still in your body. That's
yeah,
what
I've
freaks
had
me
them
out about
too.
COVID. Like,
Yeah.
COVID doesn't leave your body. It doesn't get
Yeah.
fixed, even if, like, it's still there. I'm like, what? And so I had chicken pox when I was 8 and I got shingles in my 50s. So 50 years later, like,
Yeah.
holy shit, it came back. And now I have reoccurrent. And even my doctor is like, I don't understand how you have reoccurrent shingles. Like, you've
Yeah.
had both vaccines now and it shouldn't come back. I'm like, I don't know. I want to talk to somebody. Like, does the spinal injury not create, like, I don't know, but it is incredibly painful. And now I can tell when I'm getting it because I get a migraine and I feel like I'm being sick. And then, but
Oh,
Where are
that's
they
one of my
located,
reoccurrent
Ellen?
things. Huh?
Where are they located on your body? Because
I
mine
get
were
it.
up here. Mine were
Oh,
up here.
yours were up there. Mine get on
Yeah.
my lower back, generally on my
Um,
right side, just on my lower back or on my
yeah.
right hip. I have had it once on the left. So it's shingles and not herpes or something else because it doesn't
Yeah.
cross the median. So if the rash doesn't cross the center point of your body,
It's
it's
the
only
one
on
side.
one
Yeah.
side, it's shingles.
Yeah.
Because
I
they do
didn't
look.
know that.
Yes,
Yeah.
that's how you know it's shingles. Hey, Darren, welcome. So glad you are here. Good to see you too.
Yeah.
Andrew is here. He was letting us know. So that's something I've been dealing with, but also getting doctors to be like, well, it's not, recurrent shingles is not a thing. And you're like, okay, but I have it. It's
Yeah.
not unheard of. I'm not
Do you
making it
get like the
up.
little blisters, little pustules
yeah.
on that, or yeah.
Yeah.
Yeah, but so here's the
Ellen,
thing. You have to get in with the dermatologist right when the blisters are there so that they can test it for what it is. Like, that's like
Wow.
an
Ellen, you're not
avocado.
alone.
Great.
You're not alone. I've talked to 3 other people who got shingles in the months after they had the shingles vaccine, and they're
Ah,
pissed.
yeah,
But it happens. And
yeah.
I've never talked to anybody who got shingles who didn't get the shingles vaccine. So it's kind of creepy.
It
That's
is kind
interesting.
of scary. It's scary out
Yeah.
there.
Yeah, mine
Personally,
came on.
had to
Mine
deal
came
with
on
it or
before
don't know anyone, but yeah, good to know.
mine came on before the vaccine was available. Because
Okay.
it used to be you had to be like 65 or something, and I wasn't quite there. So finally, when they lowered it to 50, it's when I got it. And I haven't had them ever since. So I never had to deal with recurrent shingles, but they are
Mhm.
painful,
Yeah.
very
Did you have
painful.
it more than once though before the
No,
vaccine, Mickey?
no,
Just the
just
once.
once,
Hmm.
just once. Yeah.
So I wonder if it matters when you got the chicken pox to begin with. Because I
Maybe.
didn't get the chicken pox till I was 21.
Oh,
2 weeks before finals and graduation from LMU.
But I heard
oh
Oh,
Yeah,
man.
they're
it
horrible
wasn't
when
a
you're
big
older.
outbreak, but yeah, I had the little blisters and I had to stay home for 2 weeks,
yeah,
Yeah,
because you were
right.
contagious. You were
Yep.
contagious.
Yeah.
No.
So,
Oh, Andrew.
yeah.
What is that?
Unfortunate. Andrew's saying that his fiance dumped him after hearing the news of his disability, so he doesn't
She
have a
wasn't worth.
partner.
She wasn't worth
She
having
She
was,
then.
sucks, Andrew. We're all just gonna say it. She sucks. You're better off.
Yeah.
No. She might have
was
been
not the right
amazing.
one.
It's not uncommon, Andrew. It's difficult. Disability doesn't just happen to the individual. It happens to the whole family, the whole
Everybody
unit,
around.
and some people just aren't capable of dealing with it. And that
Yeah.
is a sad and horrible thing, but you have to know it's not you, Darren, or Andrew. It
Right.
is the individual's inability to deal with it.
Exactly.
And there are lots of people. I mean, Sean just got married. And right, Mickey,
My husband dumped me after
yeah,
about a year after I got in the chair.
Not your current husband.
Not my
That
current
was.
husband. Now I've been married for 20 years to the same
there you go.
guy. But
So
the
ask me.
previous husband just said, I didn't
Yeah.
sign up to be with somebody in a wheelchair.
Yeah, I mean, some people just can't handle
You
it.
suck.
Yeah,
Yeah.
they
But
suck. I
And
mean,
that's a way out for some people if the relationship was already rocky and stuff.
yeah.
And then this happens and it's like, I'm out of here. So
Yeah.
but you have to admit, they're also indoctrinated with all the frickin' fear, stigma associated with disability. They don't
Exactly.
understand it. I mean, doesn't mean they're horrible human beings. It means that they have just given in to the bias, the
Yeah.
systemic ableism that has indoctrinated them that disability
Exactly.
is a bad thing and you can't. So they're just responding with fear and ignorance, and
Exactly. Yeah, they
it
don't.
sucks, but is that the person you want to be with? Somebody that, because it's evolution, whether it's disability now or aging, we shift and change, and our needs shift and change. And if your partner can't evolve with you with those
With you.
changes, it's better to know early. Like I was with my partner 29 years and, he dumped me, right? Because I was shifting and changing. Menopause had changed my sex drive, my interests had changed. I had shifted and changed, and he wanted what we were back then, and he
Was,
found
yeah.
somebody that would give it to him, and so he could not evolve and change with me. And I not that I regret my 27 years with him, but you know um
Darren's ex
I
left
wish
when
I
he
had
was in the
known.
Yeah.
hospital? Oh,
Yeah,
Darren, that's low class.
Yeah. I've heard
yeah,
that
but it
before.
happens. they
Yeah.
just they just can't deal with it. It's really their inability to deal. It is not a statement on who you are as an individual. And you
No, no.
really want somebody that can adapt and grow with you, somebody that can evolve and
Yeah.
be there through the changes of a relationship, because all relationships change. They're
Absolutely.
not stagnant. I'm not who I was, at 28. I'm not
Yeah,
who I
you
was.
mature, you grow, you become more educated, more aware, more enlightened, and you've got to be moving together in the same direction. Otherwise, you kind of veer off the road and go separate ways, and it can happen, before you know it.
Yeah,
And she
absolutely.
probably carries guilt. Ha 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 ha. She carries guilt with her.
He says, yeah, Darren says she's having some issues, but
Yeah.
let him off the hook. I say you got to let him off the hook, because it's just their inability to deal.
Then.
You got to then take charge of your life and deal. Well, you don't have a choice, because you just got to
Mhm.
deal, because there it is,
And
right?
do you want to
Um,
be stuck with someone who's going to treat you shitty, who's not going to be respectful for you, who you are, because now you're a wheelchair user? They're going to talk down to you and just be downright, disrespectful and rude to you. And it's
The
like, what do
sad
you
thing is, you're the same
negative
person.
energy? You need support. You need someone that you can grow with.
They have to realize you're still the same person.
Yeah.
You're the same person they married. You just have a disability that is, to me, an inconvenience. That's a word I like to use. But they just realize, wait a minute, I still love this person. That's still the same person I met, married, and We can just go through this together. A lot of times it does make couples stronger, but like we said, a lot of times they just can't deal with it.
Yeah,
Depends
I
on
mean,
the-
the same with aging. They can't deal with the shifts, of as we go through what we go through, and either they're going to deal with it and involve with you and talk about it, or they're not. And you'll figure. I mean, yeah, it kind of sucks.
Yeah, so Andrew said he was going to propose. Lord have mercy. When he got off his holiday, and then he was on a man's holiday, then he lost his fiance.
Yeah, I hope
'cause
lost
then-
like she left, not like
Well,
lost like
said
she.
then in a car
Yeah.
accident he lost his entire family. Oh,
Does
Oh.
Andrew,
does
you're a
Andrew live
strong person.
in the UK? I think he lives all the way
That
across.
is tough,
the ocean.
and yeah, good. I mean, you guys like connected. I'll tell you the best thing for any loss, any difficulties, and medical stuff is to find people with similar situations, because I will tell you that it is. Here's the thing I always say when people in wheelchairs get together, we talk about bladder, bowel, and sex. Those are like, what do you do? How do you do this? How do you and it's because other people don't, can't relate fully and understand, even your partner. I mean, I know that they're like bowel and bladder accidents happen. They happen to able-bodied people, but it can be so shameful and difficult, and
Absolutely.
and it has to be talked about, and has to be dealt with, and it can be really hard.
Yeah.
Andrew, do you have support groups in the UK? Have you met other people in your situation? I'm making you type. I apologize.
I'm glad she left and didn't, die, which is like, but what about, like, as we're talking about health and stuff, and yeah, she's in the UK, so, we're talking about health. What have you guys thought about, and I'm dealing with this now because a good friend of mine, we're going to have to withdraw care and do an end of life. Like, I'm her medical power of attorney. Yeah, it's incredibly difficult, but what are your thoughts about, like, what is your point of, like, this is, because people, I mean, doctors predominantly think that people with disabilities don't have quality lives, and we all know that's bullshit. Like, we all have very full, amazing lives, children, families, everything, right? But when is that point? Like, is it when you're non-cognizant? Is it like, I don't, I mean, it's something I'm just thinking about, which goes with our health, because and I don't know about transverse myelitis, and Juliana, you can tell us, but for spinal cord injury, our lifespan is less. Like, we don't have the same predicted lifespan of those with able bodies.
Exactly.
And our number one causes of death are heart disease, and number one is infection. Like, because we are so prone to infections, skin breakdown, bladder infections, that eventually, North Dakota, not many chairs. You gotta get out there and find the chair people. But so I just am, as I'm pondering this, and we're making plans for a final, gathering of people for this individual. Like, we have to deal with so many health issues that, are secondary to what we have. And so how are you ladies, handling that, or what are your thoughts about the future?
My thought is that it's quality of life versus quantity of years that I'm alive, So if I can live 10 good years, happily and functioning and doing and contributing, and as opposed to, okay, I've got to take this treatment that'll maybe give me a couple more years, but you're not going to be able to get out and about. It's like, no, I want to be functional, cognitively, physically, not in constant pain. So quality of life is number one for me, I believe. And
Well,
it's
it looks
interesting
like
because
Andrew's
it's not,
enjoying
it
life
doesn't
right
compare,
now.
but I have an elderly dog right now, and we're kind of, he's 18. It's like he's like me
Wow,
now.
that's good.
He's incontinent. He can't walk. He scooches himself.
Aw,
He's blind, all these little things, and it's like, but hey, he's still wagging his little tail. He's still, and it's like, you know what? He's like me. It's like I can't say goodbye to him yet,
Yep.
until I
No,
know
you'll
he's still
know when it's, you'll know.
exactly. Yeah.
And we were just saying Andrew's on a cruise. Mickie, you were saying
No, I
about
just said Andrew's enjoying life right now. He won a cruise
yeah.
in Vegas.
Very
that's
nice.
great.
He's on it
That's
right
awesome.
now. Cruises are
Oh,
great. We'll try to talk about traveling probably in August, I think we said.
August, yeah, we'll do some talks about traveling. Please join us again. But what
Let
about you,
me,
Mickie? What is
well,
your
I'll just tell you a quick story. There was a psychologist that I used to volunteer for, Cascalina. She had a spinal cord injury, broke her neck when she was 19, living in New York. She became a PhD and worked as a psychologist at
Marcus
Like I said.
Sipsky?
Pardon me?
Was it Marcus
No,
Sipsky?
no, it was Melanie Fishwick.
Okay.
So she ended up buying her own house to drive. She was just an amazing woman, but she was always very bitter
Mm.
because she said, I never got to get married, kind of like God was, taking all that away from her. She was very, like I said, a very bitter person, and she took her own life.
Ah,
After she was 62 years old, she said, I'm done. She goes,
Wow.
even my cat's walking. Why can't I? She was just,
she
and the other
just
thing,
never.
she made too much money to where she had to pay her caregiver out of pocket. She
Mhm.
couldn't get benefits because she made, that kind of thing. But she was amazing. She helped so many people, but she just couldn't deal with life anymore, being a quadriplegic, and
I think
just
some people dwell on the
yeah,
negative
yeah.
aspects
That's
of
she did.
their
She was
life.
she
And
could be. We go out to lunch. Like she would drive. I'd like hang on for dear life between the two seats. No, we didn't go far. She lived in Pasadena, had a great house, but she just got to the point where she was just done. She said, I'm done. And she just took her own life with about 20 Ambien one night. She sent all her friends an email, and it
Uh,
was devastating. But she just said,
wow.
I can't deal with this anymore. Like I said, she's 62. She's been in her chair since she was 19. And she just was just kind of like, have you ever been around somebody that's emotionally draining? Because the
yes,
negativity is
Yeah.
so
emotional
powerful.
vampires.
And I was
Yeah.
trying to give positive feedback about all the things she was able to accomplish,
Yeah.
but it was just not enough. She just said, I'm done.
But I will say
And
a lot of people that go into psychology go in because they're dealing with other issues. And I'll guarantee that other issues she had and her personality was, again, like you said, Mickie, it's still the same person. The
added
Right.
to
And
it.
she was,
just
but she didn't have
magnified that.
family. She didn't have family support either. They thought she
Yeah,
was a
that makes
lesser
it hard.
person. They just didn't want to deal with her. When she wanted to go away to school, they said, fine, good riddance, pretty much. So she
Yeah,
went
Yeah.
to Michigan first, then she went to USC to get her PhD, and I just really admired her. So I would just do her filing, things that I was able to use my hands that she couldn't use. But she'd use a device
Mhm.
to do her typing, and she'd see people, in her office.
that's
But
sad.
this is a
But I
tough
mean, I
story.
got married after my accident. I never thought that I would. I mean, I know that again is that stigma about disabled people don't get married and have
A
kids,
lot of
but
people.
I did. I got married. I had kids. I had a great marriage for many, 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 many years, and my husband didn't leave me because of the wheelchair. Like that, he didn't go like I'm done with dealing with that. Had nothing to do with it. It had to do with
Yeah.
midlife crisis and
Marital
you
issues.
know
Yeah.
just the same thing that every other married couple goes through at their silver years, right?
Exactly.
So,
Yeah.
and here I am thinking, I'm applying for a Fulbright scholar to go teach in Greece for a semester, and
Oh no.
I'm like I'm hitting 60 with my wheels spinning because I think that you know, people live as fully as they believe, and there's so much that we can do. And Juliana is going to go change the whole system so we can
Yeah.
work and travel and love without getting our shit taken away, which is good. I
There
mean,
you
the
go.
airlines are changing everything. Like they are being Pete Buttigieg is like on their ass. Like you need to make travel safe, easier and better, and
Yeah.
countries around the world are looking at accessibility, and there is just so much life to be lived that it doesn't
Absolutely.
matter if you're doing it on wheels, crutches, a cane, it really is getting out there and doing it, so Andrew's playing I don't know what in Vegas, but he's winning and going on cruises. I mean,
Yeah.
and when you
And
do what
Darren's
you love, that's where you meet
yeah,
people, right?
Yeah.
Darren's new chair that he was talking about, the Quantum Edge. Now, 5 years ago, that was not an option. Talk about Medicare reform. We just in the last 2 years, we managed to have Medicare pay for chairs that have rising seats. But fought 13 years, folks. 13 years we fought to get that one change.
change.
And now on Wednesday, I'm doing the roll on Capitol Hill, and we are fighting to have Medicare say, yes, you can use a power chair outside and we'll pay for it.
You're doing
So
on
these
Wednesday?
That's crazy.
little things.
Yeah.
It is.
It
And they
takes
now pay for
time.
power assists. They pay for the power assists for manual chairs. Like it's
Mhm.
like no, I had no problem. Well, I haven't gotten it yet because they sent the wrong chair, but that's a different issue. But my power assist, no problem getting my power assist, right? And I will say, if you're in a manual chair, folks,
Get
start
a
with the
power
power
assist and
assist right away,
save
and
your
save
Yeah.
your
shoulders right
arms.
away.
Yep, save your arms. You can go so many places. I just was going over rocks today with my new puppy to
Yeah,
try to.
that's one of the issues. I would say in the past year, I've had more physical issues because of my pushing than I've had in the 34 previous years. And the one that's really got me right now is my right hand. It's my dominant hand, my pushing hand. My middle finger locks up, bent, and it's excruciatingly painful to straighten it out. I'm waiting to get the appointment with the
Same thing
ortho
with
guy.
Dan, by the way, Michelle. He has the
Uh,
same thing.
I have it
yeah,
in my
get a
wrist.
shot.
Mine is right here in my
Yeah.
left wrist. It just
Yeah. So pushing has been extremely difficult. So I just got some hand-me-down emotion wheels put on my chair, and I'm excited, ready to go again. But
I will
I've
tell you,
known you.
I love the Yamaha Navi. I
yeah,
didn't think I was gonna like it, but I abso-freaking-lutely love my power assist. I
oh,
can wheel to work from home, which I could
Yeah.
not do. I'm only 3 blocks away, but there was no way I could do it in a reasonable amount of time. And I was out and we'll talk about this, but when I was in Greece, I was everywhere with my power assist all day and
nice.
could just do things without having other people push me, right?
Yeah.
And that sense of independence, right? Mickie, like
Yeah.
you said, able to do
Yeah.
your own stuff.
Or
That's the
just
bottom
moving
line.
out today, and that's it. I'm done. I got to
We
go
all want
back
to
to.
be, we all want to be independent.
Yeah.
Absolutely.
But
I was
remember,
just gonna,
I was just going to say, independence isn't doing it alone. It's getting
Yeah.
the job done. So if you need someone to push you or need someone to reach
yeah.
stuff for you or need in-home
You
supportive
can,
services so that you can work, you're still
Or you
independent
need
because
a
you're in control
special
of your own
tool.
life. Yeah.
Exactly.
you can be
You know,
independent by directing your care.
Yeah.
absolutely.
Darren asked us a question. Do y'all have finger movement, and how many times do you have someone move your legs? So I'm a T12 paraplegic. So
Yeah,
I've
me
got complete
too.
finger movement, and I can reach down and move my own legs.
Yeah.
So how about you girls?
I have limited hand use. I do have quite a bit of weakness, but I'm also able to move my own legs.
Yeah. I'm a
Mickie?
pair too. I'm a pair too, a low pair like Julienne, and I can move my legs, although I really don't very often. Except when I'm in bed, I, move them to turn over. But otherwise, I don't do any stretches or anything.
I'm
So,
a
so
I'm a C8T1 incomplete. I have some effects in my hand. My left hand is actually better than my right hand in the intrinsics and buttons. I have no thumb muscles, so I do have
Mhm.
problems with grip and everything else. I can move my own legs in and out of bed and pick them up, and I try to do that. But I also I go to the CSUN Center of Achievement and I get stretched twice a week, and if they're not in session, I make my daughter stretch me, and I stretch and stretch and stretch all of the time.
Mhm.
I think that it is so important, that mobility, that flexibility, because
To stay over.
once you start to seize up, it becomes so much harder.
Yeah.
So
mhm.
Boy,
even
you
if it's
bet.
somebody's home, yeah. So it's just again. So those of you that are newer in the chair, we all have some years underneath our belt. So
Yeah.
um, right? I'm 41.
Especially if you
Michelle,
can,
you're about 40, right?
Yeah, mine was 40 in last January.
Okay.
especially if you can roll over and lie on your stomach, because since we're all sitting like L's all the time, if you get
Yeah.
these muscles contracted, you're sunk. So if you
Yeah.
could, and
Oh,
I
that's
also have
one.
a stand,
Yeah.
What,
stand
Mhm.
and I can
It's
stand
good for
in
your organs too
real.
to just stretch out and get a good
yeah.
breath and stuff. So
Yeah,
That's so
absolutely.
important, Julianne. Newly injured people should try really hard to sleep on their stomach. Because if I try to sleep on my stomach, my butt sticks up in the air because I have contractures. I don't have my muscles in my legs are
oh,
so tight. But if you can start by sleeping on your stomach, you get used to it, because I'm not
wow.
comfortable on my stomach. I don't know about you guys. I'm just not
Oh, I
comfortable.
can't. Yeah, I can't sleep on my stomach, but I do lay
Yeah.
prone a lot.
So yeah.
Yeah, and I get stretches. So when I'm at the center, I literally lay on the table and have them stretch my back legs and really work on that. And mine is my left leg because I broke my fib tib from the knee down, and I have a metal rod in my left leg from my knee to my ankle with about 150 screws in it. But that I have a hard time getting my knee to go all the way straight, but I really work on trying to get that sucker down. And when I lay on my stomach, it stretches it better than I can. And then
Yeah.
I stand too. So Juliana, you were talking about the standing frame or somewhere where you can stand up.
Yeah,
I've got a standing frame and a standing wheelchair, both. And believe it or not, they're not that expensive. I mean, most of the stuff that we know, in the medical field will cost you $30,000. I think my standing frame was 2,000 and my standing wheelchair was 3,000.
And
So,
I think that if you have a good somebody to write it up, a doctor and a PT, sometimes stuff can be covered. Also, if you're working, it's a tax write-off because it's medical equipment. So you can write it's things that you buy as a tax write-off for medical equipment. It's also if you need to stretch for work, right? So if you need to stretch, because if I don't stretch, I'll have spasms that'll throw my ass out of the chair. I can't work
Wow.
with getting my spasms so bad I'm falling out of my chair. So stretching becomes an impairment related work expense, and then that comes off the SGA. So so because you're only allowed to make $1,400 before you lose your benefits. So however, if you made $2,500 and you had $1,000 of SGAs, you could move down below that. So Darren completely crushed his neck, and the neuropathy can be horrible, right? So keeping fit and stretching reduces those secondary issues that we can get.
Yeah. And I also keeping busy, keeping yourself distracted, because I mean, I have pain and sensations and burning, 24/7. And if I'm not thinking about it, I'm not feeling it. But the minute we start talking about it, oh yeah, I can feel it, under the thighs and under here and there on the lower back. But if I'm busy and I'm doing something preoccupied, I'm not thinking about that. So you really have to occupy your mind so that you're not just focusing on what you're feeling at that moment.
Is that true for you too, Mickie? Like, is it the end of the day or when you're not doing something that all of a sudden like, oh shit, that hurts?
I fortunately really don't have to deal with too much pain. Just
Yay.
internally, just the pins and needles type of thing. I've just gotten used to, but I'm really lucky I don't have to deal with pain. And I was just going to tell people, before we sign off in a few minutes, we have about 10 minutes or so, that one reason we're on here is to get women, especially over 50, to feel good about themselves, to still realize there's a lot left to live. There's a lot left to do in life. Travel. Look at Ellen. She's going to go back to Greece, right? You're going to go back to Greece and maybe even get a job, and that would be awesome. Because unfortunately, we see so many women that get disabled, get hurt, and their life stops. They just think they can't go out and do anything anymore. And it's just to the contrary.
Or don't think they can ever meet someone and be married or have children, and all of that is a possibility.
You have to make yourself available by just being out there.
And that goes for the guys too. That goes for the guys too. Like we're here for the gents too, but we really want, because women in healthcare are often any women in healthcare are underlooked or we don't receive the same level of care, and we don't receive the same level of respect. And then you add a disability to it, and then that's doubled. And then you add age, and now now we're facing these intersectional identities of marginalization that we have to be like, oh hell no.
And the thing is, what I tell people, is nobody knows your body like you do. You know when something's off. It could be just some little sensation or whatever, but you know your body's not right. And when you talk to your doctor, whoever it is, you need to be, persistent in what this is happening. This is what I'm feeling. This isn't normal. Don't let them brush you off. Oh, it's just whatever, part of aging or part of menopause or part of whatever, no. No, I want an answer, and I'm going to keep asking until we find out what's happening and what's the solution here, you know?
And if the doctor blows you off, or is what I call the doorknob doctors, where they're
Yeah.
one hand on the doorknob while they're talking to you,
Yeah.
find another doctor. Right
Yeah.
now, all of my doctors respect that I know more than they do about
Mhm.
me. So they'll
Right.
shut up and listen, which is
Yeah.
amazing. So if the doctor is a doorknob doctor, blow them off and find a good one.
Yeah.
And they're out there. The first meeting may suck because my doctor who just is now going into research, so I'm getting a new one. But the first year she put me down as a paraplegic on my paperwork, even though I told her I'm a
Yeah.
quadriplegic. I know that I look like a paraplegic and I function, but I have I have dysreflexia. I have all the
Yeah.
quad things that you freaking have to know about just
Yeah.
because you don't
Makes a
do it.
difference. Absolutely.
But she researched it and looked back at it and changed everything and grew and like you,
Great.
Juliana, realized that she needs to listen to me. And so I'm
Yeah.
hoping that I'm getting a senior resident to be my new doctor. And I'm hoping that as a senior resident, they're even more open, and it's female because I definitely want
Yeah.
to,
Exactly.
as a female, I want to work with female doctors because I feel like male doctors, especially if they're older, can, be a little dismissive.
Yeah. Hmm. Yeah.
I'm
And that's the
surprised how
thing, if
many
they're
people
open
don't.
to you explaining something to them about how your body functions and all of that, I think they're, if it's a good doctor, they're going to be grateful that you're taking the time to explain to them, okay, dysreflexia, it happens when this, happens. And these are the symptoms and all of that. And so never let an opportunity to educate someone, pass you by, because then they'll be able to give you better medical care, because then they're more aware of what they're dealing with, having a
And
problem.
Darren says it took him 90% of 5 years. And I'm saying, think about how many years you lived with the, sort of the implicit ableism
Mhm.
that is perpetuated by society. Being able to, get into your own brain and start, addressing the internalized ableism that we all have to have and start to be comfortable with it. That's incredible, man. And you'll just keep realizing that you are the same person. Your strengths will be magnified. You just operate differently and have to adjust, and then you'll grow and evolve. And that is the key, I think. Just evolving, and
And I know that you guys are, well, one's in UK and the other, what was it, North Dakota? And you
Yeah.
might think there aren't other people in chairs. Maybe you're just not getting out enough and going to where these people in chairs are. I'm sure there's, people out there. There was, we now have a southern Santa Barbara County group, because everybody used to come to Santa Barbara. And then once they started their group, they found out there's so many people in the, Santa Maria area that, hey, have nowhere to go. And they just, and if it's, if there isn't a group, think about starting one. Just, hey, let's meet at
Yeah.
the coffee shop or
and also
whatever.
and Triumph has their Zoom, so they have a lot of online Zoom sessions. Check out
Exactly.
Triumph Foundation SCI, and they have a lot of Zoom support groups that are
Yeah.
amazing, and connecting with people not just here in California but all over. Because I will say it was meeting other people that really helped me understand um, I wasn't alone.
Exactly.
Other people are going through this, and whether they have a spinal injury or an invisible impairment, meeting other people who are open about addressing, some of the issues they face, it makes such a
Mhm.
difference to not feel alone
Yeah.
and to connect.
Mhm.
And I
And
just
when you're
went to
getting
I
injured,
just went to Triumph's hand cycling clinic last Saturday,
okay.
and that was so much fun at the Rose Bowl. It was just great. And they
Right.
have every year they have their big sports festival in Santa Clarita, the wheelchair sports festival, and that's where they have. How many would you say, Julianne? Probably 200 at least. People
Yeah.
not all in wheelchairs, but so many people in wheelchairs doing
Mhm.
all sorts of things. And that's
Yeah.
where
Yeah.
you feel part of the community. It's just a great event. So they always have something going on. So if you
And
go on to Triumph's website, it's www.triumph and it's -foundation.org.
Yes.
There's
Yeah.
also Craig Hospital in Denver that has skiing clinics. There's, you know, United Spinal will talk about events that are all over the country. New Mobility Magazine has, you know, people from all over and blogs and ways to comment. It's that
Yeah.
connecting because A, not only do you connect with other people, but you find out about accessible travel, accessible driving, you know, new products because new products can, man, make life hacks and
Change
make
your
life
life.
Yeah.
easier.
Yeah.
You know what
Yeah.
United Spinal has? They focus, and the Kelly Brush Foundation has it too. They have ways that you can connect with other people who do the same sport as you across the
Yeah.
country.
Yeah.
So if you like to hand cycle at 8 o'clock in the morning, you can find somebody else who likes to hand cycle at 8 o'clock in the morning, and all of a sudden you got a buddy.
Yeah.
So the Kelly Brush Foundation, BRUSH, is another one, and United Spinal has listings for everything.
Tons of resources. Absolutely.
And Darren, a lot of cruises, I know Andrew's on the cruise and he'll tell you, a lot of cruises are super accessible and they
Yeah.
have the elevators that take you down to get on the boat to take you ashore and
Nice.
they have certain boat. There are so many accessible cruises and the rooms are really good. Now I always bring a raised toilet seat because I don't know who decided that the 18-inch height for a frickin' toilet seat was ADA. I'm like, that's still a 6-inch bump, people. That
Yeah.
I don't know where that number came from because
Came from.
it is way too low, right? So
Yeah.
I always carry my toilet seat with me, you know, and put it on there. Some hotels really already have them. You can call ahead
Yeah.
and see if they put them on. So the Marriott in San Jose, the maintenance comes in and puts it right on your toilet for you, and so I don't have to carry it with me there. But
Mhm.
looking at those life hacks that make things easier makes it more
Absolutely.
enjoyable.
Yeah.
Mhm.
And talk to people. You learn tricks from other people all the time, regardless of how many years you've used a wheelchair. I'm always picking up, tips and little things here and there from other people, newly injured people, people I've known a long time. So, put
And
yourself
Darren
out
was
there.
saying, yeah, and Darren was talking about Craig. He missed getting the opportunity to go there, but they have often lots of programs. They have some studies that go on there that you can participate in. They're connected to skiing. They do ski trips for all levels of injuries, and so I mean, just because you weren't able to go there for your rehab doesn't mean there isn't opportunities to.
Available. Yeah.
Yeah.
Right. It's still there, just
Exactly.
like Ellen going to Greece,
Yeah.
and me being a Miss Wheelchair California at age 64. You just never
There
know
you
what's
go.
ahead.
And
Yeah.
when you go to Michigan,
Grand Rapids is August 19th. That week
Awesome.
of August 19th through the
Good.
26th, I'll be trying to be Miss Wheelchair America for crying out
Woo!
loud.
There you go.
you
Oh
Miss
boy,
Wheelchair
yay.
California. That's right.
Yeah.
Who
And you
votes?
think I'll be talking
Who
about
votes?
Medicare? You bet.
Yes, absolutely. And those are the places. And yeah, I think the key is, looking for the resources that optimize your function, reduce pain, and allow you to live and do what you want to do. And there are so many things out there.
Absolutely.
Just resources, organizations, supports. It does take work, unfortunately. They're not, it does take work, but when you start
Yeah.
looking, you'll find the people and that it
Exactly.
makes all the difference in the world. Once
It
I,
sure does.
came to terms with the fact that yes, I am disabled. I
Yeah.
can't hide it. I am a disabled person.
This is,
And I
yeah.
met other people. Yeah, it made a huge
And we're
difference.
not and we're not ashamed of it
No,
at all.
Yeah.
No,
absolutely
not
not.
at all.
And we're here to educate people, just like you said. What really surprises me when medical personnel have no clue between a quad and a para. Like you were
Yeah.
saying, like, wait a minute. You'd think that they would know if anybody. Because people off the street, they don't know, but a
No.
a doctor, or, medical professional,
May
they
have
should
been
be.
mentioned in med school.
Yeah, exactly.
Aw,
That's
thanks,
you.
Darren. Darren
You
says he
have
hopes I
two
get
options.
Miss Wheelchair
Either you
America.
sink or you swim. If you fight for your life and you dog pedal it as fast
Eh,
as you can to keep going forward, or you just give up and you sink. That's
Yeah.
that's how it's our lives. We have to want to and have the will and the desire to move forth with our lives and be active and function
And
being
you
an
can
independent.
cry, right? And you can grieve. You can grieve the
Oh,
loss
absolutely.
of mobility. You can
Yeah.
cry. There's nothing wrong to mourning. I mean, it's like people mourning, they're not the same at 21. It's a natural process. We
Yeah.
mourn that loss as we evolve,
Mhm.
but then we embrace and celebrate the new adventure, the new body, the new
Absolutely.
opportunities. And it's not, again, it's not getting over it. You will never get over this. We will never
No.
get over it. We get
Yeah.
through it. And through that
Exactly.
journey, we learn and we connect and we grow. And it is that
Yeah.
acknowledging the whole positives and negatives, the tears and
Yeah.
the laughs and trust me, there's
Mhm.
some friggin' laughs. We all know
Yeah.
that we have
And like with
fallen
grief,
in our own whatever and had to have, like, I mean, my biggest one is when my friend, like, we're in a crazy bathroom, she has to help me cath. Like, I'm sorry, I cannot see. Yes, Juliana, I still can't do it by touch. I tried. I need my light and my mirror. And if I can't have that, I need somebody else to guide that sucker in there. I have tried and it ends up going in the vajayjay. And now I got to throw that one away, try it 4 times. Like, screw it. Give me my mirror and my light. So,
No
yeah,
judgment here.
Yeah.
You
I
do
no,
just
you.
can't do
no.
it.
We
So,
just we just have a new normal, basically.
yeah.
Mhm.
And it's
New
not
normal.
about
Yeah.
accepting and being okay with the loss. It's about learning to live with the loss. Okay,
Right.
this happened. This part of me is gone now. So
Right.
now I have to reinvent myself. I have to
Yeah.
figure out how I'm going to go from here on out.
Yeah, we acknowledge the changes, and then we find the
Absolutely.
resources, supports, and equipment and people
Yeah.
that allow us to live fully. And, I teach that to my little 18, 19-year-old students who are dealing with many with invisible disabilities,
Mhm.
POTS or ADHD or depression or autism, and,
Whatever it is. Yeah.
helping them come out disabled. Say it. I am disabled. I am proud. And once you say it, then you can find the things you need to be successful, because everybody needs something to be successful. Everybody
Mhm.
needs supports and technology and equipment. It's just
Yeah.
looking at what you got and figuring out what the hell you need.
Mm-hmm.
Because this
Well, I
puts a
think
little
we're
damper
over
on
our
the
time.
self-esteem.
Oops. Okay.
I think we
Sorry.
went over 4 o'clock.
All right.
It's all
Okay.
right. We started late.
Bye, everybody. Good to see
Um,
you.
All right.
well,
Do we have sponsors banners there?
yes,
Oh,
there we
Here
yes.
we
go.
go.
Thank
Thank you very
you
much,
to our
mobility professionals, urology professionals. You guys are great. Check them out. And they have been our sponsors for a while, and we're very, very grateful.
And
Thanks,
we
and
hope
thank you
Donwood.
guys for joining us
we,
today, even though it's quote unquote the women's show. Thank you for joining
I
us.
know.
And
I love that we have these two guys on. And we won't be
I
here
love
on
it.
July
And
4th because that's on a Thursday.
absolutely.
yep.
Okay, just
And you're all,
let
yeah, we're
everybody
not
know.
here next month, right?
Right,
No.
because
Right.
that's July 4th.
Got a break
We'll
in
all be
July. We'll be back.
celebrating Independence Day.
Yes.
But come back and see us in August. You're all welcome, and we really appreciate you, Darren, Daryl, and Andrew, and the other 5 people that are out there watching. Share it with your friends. Pass it
Some
on.
people,
We really want, the more we have, the more we get, like, great information from you guys. So
And
you're as
August is going to
important.
be what, travel and leisure activities, Sarah?
yeah.
Yes, travel
So
and leisure. And I think the Greek National Tourism Organization is going to sponsor part of that episode. So I got to talk to
Oh,
Sean about
nice.
that. And,
That'd be
Yay.
great. That'd be great.
so, and again, the world is becoming more accessible. And the more people like Juliana get out there, and the more that Mickie and Michele get out there and just live life, the more
Absolutely.
everybody in society learns that access improves the quality of life for everybody, whether
Yeah.
they're in a chair, have a rolly backpack, a kid in a stroller, then we get more, and then we can do more. So it's like a
Mhm.
moss. It rolls and get bigger, like a snowball.
Exactly.
It snowballs. That's the word I'm thinking about.
Yay.
There we go.
All right. We
All
will
right.
see
Thank
you
you
in
all.
Bye,
August,
everybody.
everybody.
Thank you.
Thank you.